Hi everyone, welcome back to Aspergers from the Inside. You're here with Paul. I make weekly videos sharing the human side of autism, so make sure you hit subscribe to get the latest content. So this week's Patron's Choice video is on autism, trauma and PTSD, post-traumatic stress disorder. Now, if it's not immediately clear to you why this is such an important topic, don't worry, it soon will be. Let me put it very simply. If you want to understand autism, you need to understand trauma. We know that trauma can cause autism-like symptoms. So while autism and PTSD can look startlingly similar from the outside, there are some crucial differences that we need to know. As we'll see, the lessons we learn from polyvagal theory and the principles of trauma-informed care are essential for improving autistic mental health. So what's the difference? How do they overlap? And why do they look so similar? First, we'll get clear on what we mean by the words autism and trauma. Next, we'll look at the reasons for why there is such a significant overlap in symptoms and behaviour, using a Venn diagram to break it down so you can clearly see the difference. We'll explore some of the reasons that trauma is so common among autistic people and what good autistic mental health looks like. Finally, I'll share 5 core principles of trauma-informed practice that you need to know when working with any autistic individual. So what is autism and what is trauma? Firstly, just to be clear, autism and trauma are two very different things. I've heard people say that autism is just trauma, and I can kind of see how someone might come to that conclusion, given the huge overlap that we'll see later. But let's be very clear. Autism is not trauma. Trauma does not cause autism. To put it simply, the key difference is that autism is a condition you're born with. Our brains are literally wired differently, whereas trauma is something that happens to you, an event or series of events that has a lasting impact, best understood as a kind of psychological injury that can be healed over time. Autism is a pervasive, lifelong neurodevelopmental condition, and what that essentially means is that our brains develop differently, and that affects everything. It means that we have a variety of preferences and behaviours that are unusual, to say the least, and this results in, most notably, challenges in social communication and interaction, among other things. What we usually refer to as trauma or PTSD are symptoms that arise from an incident that overwhelms a person's ability to cope. According to the book Principles of Trauma Therapy, an event is traumatic if it is extremely upsetting, at least temporarily overwhelms an individual's internal resources, and produces lasting psychological symptoms. To get some clarity around this, I asked autistic clinical psychologist Steve Braun, who regularly works with both autism and trauma, if there is an easy yet accurate way for us to understand this. Steve told me that in research and clinical practice, there's a helpful distinction between simple trauma and complex trauma, with the complex type being more relevant to autism. Simple trauma is when the person experienced a single distressing event, like a car crash. And complex trauma is where the person experienced multiple negative events over a long time, for example, growing up in an abusive or neglectful home situation. In terms of diagnosis, someone who continues to be distressed by a traumatic experience and finds it hard to move on may qualify for a DSM-5 diagnosis like PTSD. Here's what the World Health Organization has to say on the matter. Complex PTSD is characterized by severe and persistent problems in affect regulation, beliefs about oneself as diminished, defeated, or worthless, accompanied by feelings of shame, guilt, or failure related to the traumatic event, and difficulties in sustaining relationships and feeling close to others. These symptoms cause significant impairment in social, family, educational, occupational, or other important areas of functioning. Wow, when I read this, the first thing I think of is that for many people, these 3 things basically define the autistic experience. Problems regulating your emotions, believing that you're broken, an endless chain of broken relationships. Autism and trauma are 2 very different things, but to help us start to pull them apart, let's look at the ways in which they're similar. First off, both experience social difficulties. Our different life experiences make it difficult to relate and communicate with others, leading us to feel out of step with normal people. They sometimes call Aspergers wrong planet syndrome, and at times it literally feels like we must be aliens stuck in a world full of these strange little humans. How are we supposed to relate to our peers? As a result, we may isolate ourselves or avoid social interactions due to experiences of stigma, misunderstanding, or judgment from others. Both struggle with feeling overwhelmed and difficulty regulating emotions in general, often accompanied by high daily anxiety levels. Ask any parent and they'll tell you about autistic outbursts that seem to come from nowhere. Sometimes our sudden emotions are a surprise to us too. Self-soothing stims are part of normal human behaviour that people try to do to calm themselves down when they feel anxious. In the case of autistic stimming, this may also be a way of releasing energy or maybe even a sensory behaviour. If the world is not safe, then seeking certainty and insisting on routine can be a way to try and manage anxiety. We have sensory and cognitive differences, so instead of avoiding distressing reminders of a traumatic event, the autistic person may be avoiding unpleasant sensory situations or tasks that are cognitively difficult or draining or anxiety-producing. We can manage triggers that could otherwise overwhelm us by, for example, staying home and avoiding crowds or planning everything in advance so that there are no unwelcome surprises. Both can have repetitive thoughts, obsessions, interests, or repetitive behaviours. Concentration and attention can be affected by intense thoughts or interests or memories, whether due to special interests or memories of a negative event. Differences in our attention and executive function also make concentrating on certain things very challenging. So, for example, I can maintain laser focus on complex mental problems for hours and hours, but 2 minutes of small talk and I'm already struggling to stay with it. Dissociation is a type of disconnection, like feeling that your body isn't really yours and that you're only really observing it from the outside. It may be a protective response to ongoing high levels of anxiety or distress, but there are also instances of autistic dissociation occurring without any trauma. I have a friend who described his childhood like watching life on TV. It just wasn't quite real somehow. And another who remembers people talking to her as a child, but she never talked back. She just didn't realise that she was part of the show, that she was supposed to participate in life that was going on in front of her. So as you can see, there's a huge overlap between PTSD symptoms and observable autistic behaviour. In fact, this is precisely why diagnosis based on behaviour can be so inconsistent and why diagnostic overshadowing, where PTSD symptoms are dismissed as just autistic behaviour or vice versa, can be such a huge problem. Unfortunately, incorrect and/or unhelpful diagnoses can be extremely damaging for autistic people, especially late identified autistic women who may receive half a dozen different diagnostic labels but no effective help. We know that behaviour is only a symptom, so to be helpful, we need to look deeper to what is causing the behaviour in the first place. So before moving on, let's take a look at some of the reasons for such a huge overlap. We know that traumatic events cause a lot of stress. We also know that our body, specifically our autonomic nervous system, responds to stress in a certain way. We literally call it a stress response. When in this heightened state, our ability to relax, to socialize, to connect, and even to communicate with the people around us is dramatically reduced. Stephen Porges' polyvagal theory describes this phenomenon exceptionally well. It's a natural survival strategy designed to help keep us alive in the face of danger, something that could kill us. We need to react and respond straight away. No time to stop and think about our feelings, just run. Right now, your life is in danger. In that sense, one way to think about a stress disorder is a little bit like an autoimmune disease. The functions of our body that are designed to keep us safe and healthy are working in overdrive, causing massive problems. In the case of autism, our differences also mean we find it difficult to socialize, to connect, and to communicate with most people. So we may already exhibit these behaviors even without any stress or trauma. And now for the elephant in the room that we haven't talked about yet. On top of everything we've discussed so far, the autistic experience of living in a world that wasn't designed for us means that a lot of us are also highly stressed and anxious. If shaking hands is enough to overwhelm your ability to cope, for example, then living in a world where people regularly expect you to shake hands and don't understand when you try to say no is extremely stressful and anxiety-producing, leading to the heightened stress response and associated symptoms we discussed earlier. Some have even suggested that the experience of being autistic in this world is traumatic in itself. Humans are really good at spotting the odd one out and keeping their distance. Ostracism, misunderstanding, stigma, rejection, exclusion, and invalidation begin at a very early age. We also know that adverse childhood experiences have been shown to have a tremendous negative impact on future experiences. But instead of being too prescriptive, I'm going to ask a challenging question. What if going to school or some other everyday situation is extremely upsetting and regularly overwhelms a child's internal resources in line with the definition of a traumatic experience that we saw earlier? What lasting psychological symptoms might we expect? So with that in mind, let's take a look at the right-hand side of the Venn diagram, the PTSD specific symptoms. Other PTSD symptoms include flashbacks, self-hate, self-blame, persistent negative emotional state, inability to experience positive emotions, and most importantly, the criteria that these symptoms were not observed before the traumatic experience. This is particularly problematic, especially for young children. We know that trauma causes autism-like symptoms and that childhood trauma also affects development. So if autistic behaviour looks so similar and there was no opportunity to observe typical development, how can you tell which is which or if it's both? Now, I'm the first one to admit that the distinction here isn't super clear at all. You could very well argue that symptoms such as depression, anxiety, and low self-esteem are so extremely common in the autistic population that they really belong in the middle overlap section. But then again, the prevalence of trauma, especially childhood trauma, is also extremely common. The reason I've separated them out here is because I personally believe that the reality of extremely poor autistic mental health in general makes us more likely to suffer from conditions like depression, anxiety, or even PTSD, right? Even if not directly related to autism. So notice that there are two distinct layers here, and it's incredibly important to distinguish between the two. Firstly, there's autism itself, and then there's the stress response and mental health conditions on top of that. So let's ask the next logical question. What does a healthy autistic person look like? One without negative self-talk, without depression, stress, or anxiety. In other words, once trauma is healed and depression and anxiety are managed, what's left? I invite you to imagine a person full of self-confidence, loving life, engaging with the world with a strong sense of identity and self-worth. Someone who still has extreme sensory sensitivities, who still engages in stimming behaviour, who still focuses intently on a select few passions and interests, through which they find life and energy. Imagine someone who loves to be social but on their own terms, highly empathic, who loves connection but doesn't always look you in the eye or even respond verbally at all. Even regular meltdowns can be a part of an atypical emotional regulation process. Sometimes we just need to shut down and recharge. There are so many ways that healthy autistic people can express themselves, but it's hard to see because most of us carry significant mental and emotional wounds from a lifetime of negative experiences and interactions. The good news is that these wounds can heal, we can be healthy autistics, we can even learn to embody an authentically, socially appropriate version of our true selves. But obviously society has to be a bit flexible to meet us halfway for that to happen. Fortunately, as it turns out, there are a lot of proven ways that you can help. The Blue Knot Foundation is Australia's National Centre for Excellence for Complex Trauma. In their resource, Talking About Trauma, a guide for primary healthcare providers, they refer to 5 core principles of trauma-informed practice: safety, trustworthiness, choice, collaboration, and empowerment. Here's what they had to say about them. The above principles may seem so basic as to be taken for granted, but people who experience trauma, especially complex interpersonal trauma, do not take them for granted. This is because their basic sense of safety, right to be respected, and ability to make choices has been violated. Wow, what a powerful sentence. I suspect that almost every autistic person would relate strongly to that sentence. They also go on to provide some tips to guide interaction. I'll share just a few. Your approach and style should be empathic at all times. Attune to their verbal and non-verbal communication. Recognize that a person's problematic behaviours and responses may be their attempts to protect themselves and to cope with stress. Now, I don't know about you, but when I read those words, my whole body relaxes. Imagine if the world were filled with people like this. How much less stressful would life be in general? I recently started working with a mental health professional, And in her introduction, she said, "You're the expert on your own life." Wow, I didn't realize how stressed I was, but on hearing those words, my anxiety dropped from maybe a 7 to about a 3 out of 10. I hear this reaction from so many in our community. Finally, someone who understands, who doesn't judge me, who isn't going to hurt me, someone who takes my boundaries seriously. We do not take these basic things for granted because for us, they are not as common as you think. In fact, the more I reflect on this, the more I realize two things. Firstly, how much I appreciate it, how much of a difference it makes for me personally when someone I interact with does these things. And secondly, the massive shift that I see in the autistic individuals that I work with when I make it a point to show them these basic courtesies. They respond as if I'm the first person in their entire life to be kind and understanding and empathetic, to listen and understand and respect their ability to make choices without trying to push them. Okay, let's wrap up by quickly recapping the main points we've covered in this video. Number 1. If you want to understand autism, you need to understand trauma. Number 2, trauma can cause autism-like symptoms, which is one of the reasons they often look so similar. 3 is that polyvagal theory helps us understand the physiology behind trauma and PTSD, including our body's stress response and how we can heal over time. Number 4, many autistic people have also experienced trauma. So the fact that trauma, PTSD, and poor mental health in general are so common in the autistic community, unpicking which is essential so that we can work towards good autistic mental health. And finally, number 5, trauma-informed principles benefit everyone. There are some great resources around trauma-informed practice, so if you're working with autistic people, please make sure you take this issue seriously. It will mean the world to us if you do. Finally, a big thank you to our Patreon community for voting for this topic and for your supportive patience while I took the time to research it properly. If you'd like to have your say in next month's Patron's Choice video, you can become a cup of coffee supporter of this channel for less than $1 a week. So that's it from me. Thank you for watching, especially for those of you joining us live. Make sure you subscribe to the channel. Let me know in the comments if this video resonated for you, and I will see you all next week. Bye.